Good morning, colleagues. The Ukrainian Crisis Media Center starts its work, and the topic of the first briefing is the third mission of Canadian medics in Ukraine. The speakers are Viktor Hetmanczuk, president of the Canada-Ukraine Foundation, Dr. Oleh Antonyshyn, head of the adult Craniofacial program in the University of Toronto, Ihor Fedirko, Chief of Medical Service, Director of the Craniofacial Surgery and Dentistry Clinic in the Military Hospital, and Christina Waller, Director of Humanitarian Initiatives of Ukraine Canada Foundation, and Fischuk. Hello everybody, I am Christina Waller. I am Director of Humanitarian Initiatives of Canada-Ukraine Foundation. Today, I and my colleagues have come to talk about the third mission of Canadian doctors here in Ukraine. Our project is here for the third time. During the first two visits, we operated on guys who were wounded in the east or on Maidan. We have operated on almost 70 people, and this year we plan to perform another 40 surgeries. This project is funded through Canadian government. The Canadian government have donated 1.2 million Canadian dollars to continue with this project. I won't take long. I want to introduce our chief surgeon, who is Dr. Oleh Antonyshyn, and he will take you further, telling you about what our project does. We have just come from Canada. This time our team includes 22 people, nurses, 2 anesthesiologists, and 6 surgeons, and also 2 assistants in this group. The surgeons are specialists in neurosurgery and craniofacial reconstruction. There's also one surgeon who does microsurgery and reconstruction of palm and arms. We've been here for several days already. We have checked a group of patients, and we see 60 to 65. We saw 60 to 65 people. We will operate on 40 people, and there are still patients coming to the clinic, and we plan to come back to Kiev in February. We came to cooperate with surgeons and doctors in the Chief Military Hospital. We have worked with them 2 times during our previous missions. This cooperation is going on really well, and everybody benefits, especially the patients. We are sure that we will have successful operations here. Thank you, Oleh. I also want to introduce our colleague and probably the best friend in Ukraine. He's Dr. Ihor Fedirko from the Chief Military Hospital. We operate together, and this is like a master class. There are surgeons from Canada and surgeons from Ukraine, and they operate together, do surgery together, and they together decide how to better help these patients. Hello everybody. I'd like, on behalf of the Ukrainian side, welcome and greet all the Canadian doctors and other medics who have come here to again help us with complicated surgery. Also thank those Canadian people who sponsor this program, and I'd like to say that this is a very important project for us, because this is not just a master class for young This is not a masterclass for just young doctors. This is also for veteran doctors who have been working with craniofacial surgery for long, because there are some operations that we do not perform in this country. We're very glad that the Canadian side provides us with such an opportunity, and also they give us all the necessary tools to operate on Ukrainian wounded. We have selected 40 patients to conduct surgery. Most of them were already operated upon early by Ukrainian doctors, and we are prepared for this working week. I think this will be a successful week. We will again work together, and we know how to do it. Thank you. Thank you. So this project this time is different a bit from previous missions, because this time there is an opportunity through the Canadian state. As they donated us money, we are able to leave the equipment behind at the Central Military Hospital. They will get equipment to the cost of almost 700,000 Canadian dollars, and now the president of Canada-Ukraine Foundation, Victor Hetmanczuk, will tell you more about our initiatives and our cooperation with the Ukrainian state. Hello. First of all, I will talk about this mission, and then I will give a short review of what the Canada-Ukraine Foundation does in Ukraine. Additionally, as you heard, this is a unique thing that the Canadian government has given the Canadian-Ukrainian organization such a sum of money. As usually, they give this money to international NGOs, and we now see that at last we have the trust from the Canadian government that we can engage in such activity. I want to personally thank all our doctors and nurses that they have volunteered to work for a week for free and to share their experience with our colleagues here in Ukraine, how we can perform surgery. I also thank the Minister of Defense of Ukraine, because they have provided us with all the operational surgery premises. As we have finished our second visit, we have calculated how much this would cost to take all the patients to Canada and do all the surgery there. And it turned out that it would cost $350,000 in Canada for just 1 week for 40 operations. And you should also add to this cost all the travel and accommodation, so this amounts to almost $500,000 to do this in Canada. So we decided that for us to come here, it costs only $125,000. And the donors have given us money, and we will report back to them. It's been 2 years since this project started. We came here in April 2014. Oleh was here, and we tried to find some projects that we as diaspora can take part here in Ukraine or do here in Ukraine, because there's a crazy space for work. And we decided through our specialists that we can help in surgery. I, as head of the foundation, I look at what is the strategy of our foundation. And you know, the next month we will have our assembly, and we will decide what are the priorities for our work for the next 3 years. So I suggest the 1% solution concept. This is very easy, that the body changes not abruptly but gradually, and to save this person, you know, when they are ill, we are working gradually as well. Our projects may seem small, but they are strategic. We will complete this mission. We will perform operations on a couple of hundreds of patients, and they will have a better chance to recover. Doctors between Canada and Ukraine, between themselves, will share their ideas, and we also will leave behind infrastructure at hospitals so that they continue this surgery. We will leave this for 2 years, and we won't be obliged to come again. We will be sure that we have passed on our knowledge to our colleagues and here in Ukraine. So this is a brief description of 1% solution. What does the foundation do additionally in this field? We have 8 times set such retreats, each for 8 days. We take orphans and children from families that suffered during the war. We take them to the Carpathian Mountains, and we try to get them back to the notion that there is still life and take their first steps to rehabilitation. So we have done this for 8 times already, and we are starting to plan to continue this work in 2016. We won't limit ourselves to those people, but we also have PTSD program, post-traumatic stress disorder. We are talking to people, doctors, so that they understand relatives of the patients, so that they know how the PTSD starts and then work with them. Also on the mobile phone we have downloaded a program so that people who do not want to go to doctor and confess that they have disorders, you can answer 17 questions on your mobile phone, and it gives you an assessment about your psychological state. And we have a database on this telephone, so then you can call crisis centers in Ukraine, and also you can read about your case. So we have we hope that this phone line will start the reaction when people will not be afraid to go to a doctor and confess that they have a problem. And then another very interesting thing that we are just starting to tell about. What becomes of people who come back from the front? How they can be integrated back to their families and the society? They've seen awful moments. Who will take care here of them? So that the families should know how to behave, how to treat them. So we're taking small steps. We believe that as time flows, there will be free Ukraine, glory to Ukraine.
Thank you, Victor. So basically our team now is at the hospital. All our surgeons and anesthesiologists, they started surgeries now. We'll stay there for a week till Friday. On Saturday, this is the day when we will check on all the patients, and Sunday we will go back to Canada, the whole team. And then we are planning to organize one more mission in February. And we would like to thank the Ministry of Defense that they were hosting us so nicely. And I personally want to thank our volunteers from Canada. Dr. Antonyshyn gives his time and expertise free of charge to us. And for more than a year and a half, he's cooperating with us. And we really are very grateful. Thank you, Christina. Thank you, colleagues. Any questions? Anything to clarify? For how many surgery operation theaters do you have? 3, with 3 surgery tables. We have the whole department where the patients stay before the surgery and after the surgery? Is that, do you make surgeries from morning till evening every day from 9:30 till 6 o'clock in the afternoon, 6-8 patients every day? We're happy that they gave us the whole department. Our patients can all be there, and we can monitor them easily, and we can easily plan everything for them. And we have these 3 surgery tables, and some of the surgeries take longer. We stay more than till 6 p.m. The hospital doesn't tell us that you can have this surgery room only till 5 or till 6. They cooperate with us nicely. And the question is, Mr. Colonel knows there's such a Skype communication between the military hospital in Kiev and other cities. Will Canadian side join these Skype consultations? And also, do you cooperate with Suprun's family who are organizing the courses on tactical medicine? Suprun's family, yes, we do cooperate with them. The money that we received from Canada, from the government, we give them $200,000 to them, to the Patriot Defense, so that they do these trainings somewhat different from what they do it now. Now they organize the tactical medical training, and this new initiative is more about surgeons at the front line, so that the surgeons are ready to help at the front line. And there was a question about Volunteers 100. We saw them at the hospital because they have some small office there. I visited them yesterday. I tried to see them yesterday, but there was no one there. I hope we will find some ways to cooperate. The volunteers help us a lot in the hospital. They brought us coffee and tea yesterday. Yeah, we do talk to them. In Crimean News, you say 40 patients are there, and how many people are there in Ukraine who would need such surgeries? Talking about the number of patients, we can say that those patients that need surgery, well, basically 90% of them we have gathered from different hospitals, military hospitals and the hospitals, and they will receive assistance this week. As to the patients who will need such an assistance in 4 months, we have about 20 patients with the craniofacial wounds. So we are planning to have them operated during the next mission. Any other questions? Once you have no more questions, thank you, friends, for what you're doing, and see you again.